listeners. You're listening to EBC Radio. This is 1170 AM. We're also live on the web, www.ebcmusic.com. It's time once again for HeartBeat. This is a medical program related to your health. We bring to you on the airwaves of EBC every second and fourth Saturday of the month. I'm Dr. Dinesh Singhal. I'm an interventional cardiologist. I have practices in Somerset and Monroe Township areas. I'm the director of the catheterization laboratory at St. Peter's University Hospital and an attending cardiologist at Robert Wood and Princeton Medical Centers. I'm joined by my co-host, Dr. Meena Murthy. She is the chief of endocrinology at St. Peter's University Hospital. She joins us today on the phone. Meena, can you hear me?
Yes. Good afternoon, everybody. I'm sorry I'm online, but hopefully this will work out.
Yeah, no, this will work out. So thank you for being with us, folks. We have today with us a couple of folks in the studio. I'm going to introduce them in a minute. But just to lay the groundwork for the discussion today, we wind up taking care of a lot of folks in healthcare. And one of the things we learn is that even though patients come to us often with some kind of physical ailment, individuals have symptoms, some of them are emanating or starting from a true physical problem. I'm a cardiologist. I see patients who come to me with chest big pain because they have a clogged artery in the heart. Somebody comes in with a heart attack, we take care of it. We open up arteries with balloon stents. But a lot of times we'll get folks who present to us with symptoms, same chest discomfort, palpitations, blood pressure being up. And a lot has to do with what's going on in the mind. So over the years, people have realized that the mind and body is quite connected. And what goes on in our brains then reflects and manifests itself which are perceived as physical ailments. And unless that mind is dealt with, or the issues related to the mind are dealt with, the person's not going to feel better. So the feeling of being well is a combination both of being at peace with one's physical body as well as being at peace with one's mind. And the challenge for folks who deal with issues with the mind is a lot more, because the physical ailments, with a variety of tests, with a variety of tools, we're able to figure out, and often we can see them in black and white in some form. While when it comes to mental ailments, the challenge is that folks look physically well, and often it's difficult to do some formal tests to prove a problem which exists. And it is left to the judgment and the abilities of the people who are professionals in this field to be able to make out what's wrong. And because of that dichotomy where the physical being looks so different from what's actually happening in the person's mind, it causes a lot of strain in the individual's mind, the person who's suffering, the family around them, and it takes a group of people who would then step in to help both those individuals and the families. So we're fortunate to have in the studio people from such an organization which is out here to help sort some of these issues out. The organization is called NAMI. It's the National Alliance on Mental Illness, and I have Aruna Rao. She's the Associate Director of NAMI New Jersey. She has been on the show with us, and we invited her again to share with us some of the work they do and disseminate both the information about some of these problems, as well as how they can help. So Aruna, thank you so much for coming.
Thank you so much for having me here.
And Meena, you've been involved with this organization also. So if I missed something in their introduction, if you can step in, and then we'll learn a little bit more about what they do.
Aruna, welcome. I know Aruna for a long time, the organization, and everything you said in your introduction, Dinesh. How many times, our brain confuses us with body symptoms. And so many times people have to suffer for years not knowing. So that's one side of the coin where organizations like NAMI, which does a lot of work to care for, to support, to coordinate activities, to deal with, primary mental illness, meaning the diseases that affect our brain. But also the other side of coin, Dinesh, you and I, we take care of chronic illnesses. In the last 35 years, I have become more and more humble about my ability to diagnose and take care of physical ailments, because something like diabetes or something like kidney disease or heart disease, even though we can diagnose and treat it, the patient is never better unless they're able to cope with how these things affect their function, affect their family, affect their ability to earn or support their family. So NAMI and Aruna can tell you a little bit more about the subset of NAMI that she has initiated and organized, which is the South Asian Mental Health Alliance of Jersey, SAMHAJ. It's her baby. So they have done a lot of work in peer-to-peer support, family support, and working with organizations and physicians like me, to be able to support these families in so many different ways. So I will actually let Aruna say more about it, but I just think they do a wonderful job, and the professionals that work in the committee, it's just amazing, their volunteer efforts, and everything is done almost voluntarily, completely.
So NAMI stands for the National Alliance on Mental Illness. So Aruna, tell us how you got involved with this, and a little bit overview of some of the work.
Sure. Thanks so much for inviting me to be on here today. I wanted to just give you a little bit of background of NAMI and then specifically about the program SAMHAJ, which is what I'm here representing today. So NAMI, as you mentioned, National Alliance on Mental Illness, is a national organization. It's been around at the national level for over 40 years. NAMI New Jersey was founded about 35 years ago. And really, the people who founded it were family members and caregivers of people who had been diagnosed with serious mental illnesses such as major depression, bipolar disorder, schizophrenia, obsessive compulsive disorder. So all the disorders that were very difficult to diagnose and treat. So really, it was founded on the grassroots level by family members. And NAMI continues to this day to be all about peer support. So it's really about finding people who are either dealing with their own mental health disorders or caregivers and giving these people the support they need to manage the illness. As you mentioned, you see a lot of people who are dealing with physical ailments that are either related to or sometimes even caused by their mental health issues. So what we try to do is essentially support these people in their journey both with mental and physical health and give them the tools they need to navigate a very complex mental health system. Diagnosis and treatment is still continues even to this day to be a difficult issue. Many times access is limited by all kinds of things, insurance problems, many times, people will get diagnosed with one thing and end up with another diagnosis on top of that. So really our focus is helping people navigate the mental health system and very importantly, working to erase stigma. I think one of the illnesses, if you have heart disease, if you have diabetes, these illnesses people understand are illnesses that are not necessarily caused by themselves. Whereas if you're talking about depression or about bipolar disorder, about obsession or anxiety, people blame themselves and even family members blame themselves. What did I do to cause this? It is my fault. And there's so much self-esteem, so much shame associated with this. So that is one of the fundamental problems that NAMI and SAMHAJ try to tackle. So just that is a brief background on NAMI, but I want to talk a little bit about SAMHAJ. So SAMHAJ was founded about 15 years ago.
What does SAMHAJ stand for?
So we kind of came up with an acronym. It says South Asian Mental Health in Jersey. But really, in my understanding of this is that it's all about understanding mental health. So the word SAMHAJ itself means understanding. So what we want to do is educate the community, help them understand, and help them help themselves. That's really the focus of SAMHAJ. So it's a program that is housed within NAMI, New Jersey. And so we don't function independently from NAMI, but as Meena mentioned, it's really the work of wonderful community volunteers. And I have such a volunteer with me today who's actually here to represent both the program and perhaps discuss a little bit of what she does. But we run support groups for people who are dealing with illnesses plus their caregivers. And Anisha Gosen, who's here with me today, is going to be talking a little bit about that aspect of things. But we find that our community really needs this peer support and this education to help them deal with the illness and try to live a fulfilling life.
You're listening to Heartbeat. This is EBC Radio. We are discussing today an organization and the issues revolving around mental health. See some caller on the air.
Hello?
Hi, you're on the air on Heartbeat?
Yeah, can I ask a question
Sure.
to anybody?
Yes.
I am a biologist by profession. I have nothing medical background, but I have heard this word very new, not new, which I was not familiar what it is actually is the bipolar disorder. Are people born with it or they develop as the life goes on? This is the question I have. If somebody can answer, I will be very happy to know that.
So let me start with a disclaimer that none of the people we have on the air today are actually professionals in the sense of being medical providers. I'm a physician, but this is not what I deal with. But I'm going to ask you. No, but wait. But Aruna, you deal with. You may not be a doctor, but at least you deal with these situations. So you have some basic layman's understanding. So why don't you help us understand what is bipolar disorder?
Sure. You may not have heard the term bipolar disorder, but you may have heard the term manic depression.
That I know.
Okay, so originally this disorder was called manic depression, and essentially what
Manic
it's
depression
carried from.
is as the life goes on, right?
This is a group of illnesses along with things like schizophrenia, major depression that
the
possibly
depression could
has
come-
that possibly has a
question
genetic.
is that it is not, people are not born with bipolar. This word is very kind of confusing to me. I could not get a clear answer.
Actually, maybe I can just clarify that.
Okay.
Many times, illnesses like bipolar are part of a genetic makeup. Dr.
Okay.
Singhal and Dr. Murthy can certainly say, for instance, diabetes
Okay.
is something that is part of our genetic makeup and is triggered by certain things in our life. Similarly, illnesses like bipolar, schizophrenia are part of our genetic makeup and they can be triggered by life events. So to answer your question very briefly, yes, it is part of our genetic makeup.
So
Okay.
I think to maybe it may not be the perfect example.
No, I really want to know what people do with the bipolar. Schizophrenic, I understand. They are always, inside. They don't want to see people. I want to clarify what this word actually means.
Yeah, so if you give us a chance, Aruna is going to try and explain to you what an individual who has bipolar disorder, how will they appear, or what will
that's
go.
what I want to know.
So just give her a chance to talk.
Okay.
Sure. So bipolar disorder, which used to be called manic depression, is
Okay.
really characterized by swinging between moods. And these moods can
Give us like one day, what would they be like, and another day. So give us an example of what would be.
Sure,
Yeah,
sure.
that will be nice.
Yeah, there is the pattern over here. So it's not just about, being like, sad one day and being happy the next day. It's a pattern of extreme mood swings, ranging from being extremely depressed or being extremely manic. The word mania, essentially, it means that basically somebody is extremely upbeat in a very not in a normal way. Many of us obviously feel happy and have like moods which make us feel very happy, but this is about being to the extreme upbeat in your life.
I think maybe another way to approach it is think of somebody you've been helping out now. Give us an example of what that person's been doing, what else.
Exactly, that's what
so
I
give
want
us an
to
example
go
of an
to
individual,
work.
real individual without taking any names
Sure,
of what that
sure.
person's going through.
Sure. We recently had a young woman who came out and spoke about her personal issues with bipolar disorder at one of our meetings.
They
And really,
know really, they themselves know they are bipolar, right?
yes, of course, there's
Okay.
some amount of insight there. So she really talked about the fact that there have been times in her life when she has been so low that she was suicidal, that she really could not basically deal with her daily life. And there have been other times when she has been feeling so unnaturally upbeat that she really could not even concentrate on a simple thing in her life, like for instance just going to school or her daily schedule. I'm actually going to ask Anisha Gosain, who's right here. She's actually a social worker who deals with people with bipolar disorder. So she's going to actually try and explain this to you too.
So so give us a couple of examples. So to real people who you've been dealing with.
Sure. Hi, my name's Anisha Gostein. So my passion is mental health and domestic violence.
Okay.
I work as a social worker right now with foster children who have a lot of mental health issues and behavioral issues. I actually have a personal history with bipolar because I have a family member who has bipolar disorder, and personal, I guess, experience is that there are times when she's on medication now, so she's stabilized with therapy combined, but there was an episode a couple of years ago where she was manic, so she went on a really big shopping spree. So basically, it's when you do things that are way above your extreme. So going on a $5,000 shopping spree on things.
Some people might be just doing that.
But it's when it's out of your norm, completely out of norm. Like you just go and buy random things. That's just one example. That's what she did. Or if you're constantly not sleeping for days on end, that's definitely a part of manic, the mania part of manic depression or bipolar, where you're just hyper all the time, so you don't sleep at all. You can concentrate in the sense that you can focus on one thing, but only on that for the next 5 days. So it's basically when you're extremely just hyped up, if that makes sense for you.
One more reference I would like to give you. If you go to the National Institute of Mental Health website, nimh.gov, they have very scientifically accurate and easy to understand explanations of the major mental health disorders, including bipolar disorder. So you'll find it very simply explained about what bipolar disorder is like. Of course, one of the things I would tell you is that unless you actually go to a mental health professional and get a diagnosis, that's the only way you know for sure whether someone has bipolar disorder or not.
So in a way, suppose you have a friend and you can see sometimes she behaves good with you, sometimes she's extremely, that is also a part of bipolar? What is it?
Well, I'm going to let you guys
no, I would say that's pretty much a lot of my friends. So I think that's what people are like sometimes.
Yeah, extreme. So what I mean, I have heard this word, somebody recently told me that we are a part of a group of seniors and they said, this person, I don't want to tell the name, he has bipolar. I said, how do you know? You keep on commenting about these kind of things for people. She didn't tell me much because she's not so good in, all these things, but she tries to keep on reading books and all. Okay, so basically their extreme behavior, that's what I can get from your information.
It's extreme behavior, but in a pathological sense, means that it's, one could be upset and that could be in reaction to something bad which is happening, or somebody could be angry. But if it is out of proportion, if you have, I have actually a patient who has a cardiac issue. This guy won't go to sleep for, like you said, for 5, 7, 8 days. He hasn't slept for more than an hour. So he's in that, and he is bipolar. So it's an extreme situation which is totally out of the ordinary, or somebody who's depressed to the degree of being suicidal without any explanation for any outside event. So it's pathological because you can't really explain it on based on
about sleep. I just have a comment. I know I'm senior also, and a lot of you not senior until they all complain about sleep. Sometimes I have difficulty sleeping.
Well, that's that's normal.
So that I don't take it as a bipolar, right?
No. You need to let a professional help you.
In India, also, I have sister who said I am not able to sleep these days. So whatever reason, leg pain or knee pain.
Yeah. Okay. Well, thank you so much for your call. We're coming. Before we knew, the first half of the show is already coming to an end. We'll be back right after commercial breaks. Folks, you're listening to Heartbeat. This is EBC Radio. We're talking to Aruna Rao and Anisha. They're members of this organization called NAMI. They are dedicated folks who are really trying to help and make a difference in the lives of people who have some form of mental illness. And we'll get a little bit more insight once we come back after the break. I'm Dr. Dinesh Singhal. I'm with Dr. Meena Murthy, and we'll be back right after this commercial. Welcome back, listeners. You're listening to EBC Radio. This is 1170 AM. Program is Heartbeat. This is a program about your health. We bring to you on the airwaves of EBC every second and fourth Saturday of the month. I'm Dr. Dinesh Singhal. I'm an interventional cardiologist. I'm joined by my co-host, Dr. Meena Murthy. She is an endocrinologist. And today's show, we are discussing issues related to mental illness. There's an organization called NAMI and SAMHAJ. And we have in the studio Aruna Rao. She's an associate director of NAMI SAMHAJ. And Anisha, she's a social worker and as a volunteer in this organization. Before we get back to them, let me just take this caller. Hi, you're on the air on Heartbeat. Hello?
Hello?
Yeah, hi, you're on the air.
Okay. I am a Aam Aadmi Party supporter, so I thought that the program is about the Aam Aadmi Party.
No. This is not Aam Aadmi Party. This is Aam Aadmi probably will be later on in the day. So
okay, sir. Thank you.
Okay. So from Aam Aadmi, we're back to dealing with issues of mental illness. So we had a caller last half of the show, and I think what would be interesting is if you can give us a few more examples of how you've been able to help through your organization, what these folks were suffering from. It's easier to relate to that kind of a description.
So this is Anisha on the air. I volunteer as a facilitator for the consumer support group, and I've been doing it for about 2+ years. And within the support group, we have individuals who have anything from anxiety to bipolar to different disorders. And there are a lot of success stories that have come through. There are a lot of participants who've been with us for a long time. And I think the sense that I get from everybody is that it's been a great experience for them because they feel like they have a family outside of their own family that accepts them without the stigma related to mental health illnesses, especially in the South Asian community or minorities in general. And I have one particular consumer who actually has taken the initiative to become a facilitator, or she's stepped up and become the facilitator, taking my place in certain support groups because she's been a part of it for a long time, and she's built up the confidence and the self-esteem to be able to speak up in public speaking. Is a tough thing for most people, but even more so for people with mental health issues because of the lack of confidence that they have usually. And she's been facilitating the group, I think, 2 sessions in a row, and she's done a phenomenal job. So I think that's how we help. We help individuals boost their confidence and have more, I guess, sense of being, if you will, to understand where, that it's not their fault that they have an illness, that it's a part of them, but it's not their whole being. And then we have other stories where, like I said earlier, I have a personal connection to mental illness. My sister is bipolar, actually. And, she had a traumatic event that happened a long time ago, which caused her to have this diagnosis. And she has both successes and downfalls. My mom is a wonderful support system for her, but in a lot of ways, she's been overly sheltered because, parents have a huge shame that associates them with the illness because they feel they did something wrong to contribute to their child's illness, which is not true. Whether it's genetic, hereditary, or trauma related, it's usually not their fault. So a lot of times I think parents tend to overcompensate their guilt by sheltering their children a little too much. But on the other side, there's a lot of parents who are ignorant, for lack of better words, or community members who are ignorant and not understanding where their child is coming from, or family member, or whomever you have in the community who has an issue. So,
one of the things I wanted to point out that Anisha's family is so open and accepting of the fact that there's an illness, and then they try everything possible to make things work. And we have moms and some dads who are also part of our support group, because we run a group both for people who are diagnosed with a mental illness as well as the caregiver, who is either the parent or sometimes even the husband or the wife. And what we find is many times the parent will come in with almost as much trauma as the person who's living with the illness, because caregiving can be very, very tough, especially for a major mental illness. And we've had one of the moms I'm thinking about is actually such a rock for her adult child, but she herself is also dealing with so many of these issues herself, and many times a caregiver also can be diagnosed with depression because of the pressure. However, the people who deal with it best, in my experience in the last 15 years, are the people who are willing to be open about it, not constantly be cloaked in secrecy and shame, and who are willing to say, like, I'm going to try anything that works. So I think that openness and that desire to come out and seek help is the key to getting better.
Meena, I can't see you, so I don't know if you have something to add this.
Yeah, I think the last caller, what she brought up and what the organization does, we can kind of summarize it like, there's a lot of confusion in people's mind between normal and the gray zone of maybe something is wrong with the person, as far as their mental health. And then, of course, the extreme where there is a crisis because of mental health, whether it is suicide, homicide, accident, or uncontrollable behaviors. So it is a spectrum, and diagnosis is very difficult, between, what is the edge of normal to the abnormal. And then there is a lot of stigma about a particular diagnosis and guilt with it. So finding that particular mental health professional and guiding and navigating a family who has a new diagnosis or a new crisis, through these channels, and supporting them with, all the things they have to do, including taking medications every day, the side effects of medications. So the volunteers and professional members at both SAMHAJ and NAMI, and family members who have been trained or who regularly attend the support group, they're able to then guide the new members, new people with new diagnoses or new crisis issues. Because no matter how well somebody has coped with a problem, a new crisis can bring new problems.
Meena, let me take this. There's a caller on the air. Let me just say hi. You're on the air on HeartBeat.
Oh, hi. I have my daughter. She's bipolar, and I just want to say that is a hope. Like, I'm also part of the SAMHAJ group. In the beginning, I was very confused. Like, I never ever had this experience in my family. I was so confused, but since I started worked with the SAMHAJ, and I know now what is the all this is about, and now she's taking the medication and going at therapy every month, and she's much better, and she's going to full-time work, and she's a English professor now. So I want to let you know everybody that is a hope.
Great. That's so nice of you to share with us. Let me ask you. Thank you for your call. How, before a diagnosis is made, what are some of the clues a family member or an individual who may have some insight? What should they be paying attention to if something isn't right, so that they can go out and seek help? Because when you see people, probably a diagnosis has been made, and now you're stepping in to help them. But there's probably a lot of people out there who may not even have a sense that something is wrong. So help us understand what are some of the things one should be looking out for.
I'm going to have Anisha also talk about this, but one of the things I wanted to say is, in my experience, what I've heard from families is that there's always some sudden change in the way that the child is. Many times, a lot of these illnesses manifest when people are teenagers or young adults. So there's always changes in, like, for instance, just everyday behavior. There's changes in sleeping patterns. There's changes in the way that the person deals with the family and friends. Many times there's a lot of withdrawal. And one of the things I wanted to point out with the adolescents and with young people is many times people turn to coping with substance use. And that's also one of the things that parents should really be on the lookout for, because these things sometimes go together. And one of the things we have been trying to do is exactly this, is kind of in a preventative way, is to go into schools and talk to parents about all the different things that relate to development of the adolescent. So, psychological issues, sexual development, identity development. These are all the things that parents should know about. Be aware of, like, what changes in behavior they observe in their children. And many times the most important thing that you can do is act as early as possible. If you see an issue, go ahead and address it, at least with the child and definitely also with the professional.
But as just part of growing up, a lot of teenagers have a difficult time as such as they're transitioning in that age. So there's a lot of rebellion, which is natural. Now, how do you separate that out from natural changes versus a true medical problem?
Sure. So I work with children who actually have behavioral and mental health issues, and I think it's hard to differentiate. Like you said, teenagers are teenagers. They're meant to be rebellious, and they will go through their phases, especially with bullying out there in school. So you have to know, like I said earlier, about sudden changes that you see. If their eating pattern has shifted from they eat normal to not eating at all or eating very little, that can be a sign of stress, which can cause other things like minor depression, anxiety, or if they're getting paranoid about certain things, which have no reason to be paranoid about. Like if they say, "Mom, in school, I think this kid is, saying things about me," or "I hear things at night," or, things like that, where they give you hints of, "Okay, mommy, I hear the monster talking to me." Some kids say that because they're little, they have a very vivid imagination, but you have to be aware of these little cues if they're repetitive.
And if, let's say, a parent does notice a change, who should they reach out to? Is it a pediatrician? Is it what's the right forum for them? Should they turn to, who can have an understanding for these kind of problems?
Definitely, a pediatrician is a good start, but many times pediatricians are not necessarily trained in mental health disorders also. There is, in many schools, there's actually a school psychologist on staff. That's also a good place to turn to for immediate referrals. There are therapists and psychiatrists who specialize in child and adolescent issues. So that's really a very good place to start. You can actually go to the New Jersey Psychiatric Association webpage, and it lists all the psychiatrists in the state and indicates their specialization. So I think starting with a therapist or psychiatrist, if you see that the issue is something that you really want to address right away, starting with the school counselor is an excellent place to start, because they actually know the area, they know the professionals in the area, and they can let you know whether the child has also been exhibiting the same symptoms at school.
You're listening to Heartbeat. This is EPC Radio. Our program today is dedicated to issues related to mental illness. The phone number in the studio is 732-297-9886, 732-297-9886. Are these kind of problems primarily uh, picked up in most cases in children, or do you get to see a lot of adults also?
Anisha and I were just discussing this earlier. Unfortunately, it's usually not picked up in children. It should be, because frankly, the earlier the intervention is, the more chance the child has to be a successful adult. But many times, especially, as you mentioned, teenagers have their issues, and it just gets kind of, put aside as, oh, this person is just growing up. Most people who have any kind of serious mental health disorders, it manifests in late adolescence, early adulthood. So that's high school and college. And high school and college are periods of huge transition anyway. So things kind of get brushed under the carpet because of that. And many kids actually grow up to be perfectly all right, but they're the few who are affected seriously. They unfortunately don't get diagnosed until their adulthood. And many times we see people who have been chronically ill for a long time and end up seeking treatment only after it becomes so evident to just about everybody. But increasingly, research shows the earlier the intervention is, the more chance there is of success for the child later on in life.
And Dinesh, I wanted to say that many times family members notice the problems. They're just not sure if they want to label the kid with the diagnosis. So what I do, at least with my patients and people who come to me, wondering if there's something wrong with their loved one because they're noticing this or that, but they're not willing to confront that or take that person to the psychiatrist or psychotherapist. I many times recommended that they just go and talk to a professional themselves about their own concerns and how it's affecting them. And through them, and the diagnosis becomes clear, and then they're able to bring their loved ones to the care that they need. So sometimes the family member needs as much support, and through them, the diagnosis can be made.
Right. So, when it comes to adults, do you find that the individuals reach out for help on their own more often, or is it usually the family member stepping in? And is there some degree of resistance by the individual in accepting that something could be wrong? And if so, how do you overcome that?
I definitely do see that there's a resistance from whether it's adults, teenagers. Nobody wants to be labeled, and having something, especially within the South Asian population. Everybody wants to be strong and doing well and cover their weaknesses. And so, in adults, at least in the support group that I've experienced, they are comfortable, so they're able to talk about it. But when they first come to group, they're very resistant to talking about what they're going through, talking about the weaknesses that they have, the struggles, because they think it's a sign of, shame and guilt, and I shouldn't be like this. I should be normal. So I would definitely say it doesn't matter if you're a teenager, adult. I don't think if they've not been exposed to the education or knowledge of knowing what they're going through, that they understand what the illness is, and that it's not who they are. Doesn't define them as a person. It's just a part of who they are.
I would say the family member calls very often because they're in a position to know exactly what's happening, and they're very worried and they really want some help. So they're usually the people who pick up the phone and say, okay, what do I do now? And there's actually something that is very typical in like mental health, where people who have a serious mental illness, which is I'm talking about things like major depression, schizophrenia, and bipolar, it's been observed that there's a lack of insight. For instance, if you have diabetes or cardiovascular disease and your doctor tells you have it, and you're like, you're motivated and interested in getting better, you want to change your lifestyle, you want to take medication, all that. Many times in mental health disorders, there's a lack of insight that the person has into their own condition. And that's part of the illness. They're unable to understand that they're ill. And that's where the caregiver and the family becomes all important, because they're able to see the issues and direct the person in the right way, or at least reach out for help. Some of the things that, Anisha was pointing out about, all these behavior changes. I mean, sleeping, change in sleeping patterns, change in eating patterns, All of these things, many people who are going through that don't have the insight that something is actually happening to them. And so they're very reluctant to seek any treatment. And unfortunately, what happens is you wait until things get into a full-blown crisis rather than trying to address it right away. And this is something that I hear repeatedly from family members. It's like, what is that magic thing that makes people realize they're ill and seek treatment? There was a young woman who came to our support group last month. Her name is Sabrina Singh, and she's a writer. She's someone who's living with bipolar disorder, and she's was a wonderful speaker talking about her illness. And she said when she was a teenager, she realized that she was ill. Her parents refused to accept that she was ill. And she was the one who drove the issue and said, I really want to see a therapist. I feel that I'm going to kill myself and I have to see somebody. So sometimes that happens, but most of the time, actually, it's a family member who sees it.
I'd just like to say that I think as a family member that you are your child's or adult child advocate, and you really should try to get them help in any which way possible, whether that's reaching out to a family member and talking to them about support system that you can build, or reaching out to a professional. I think it's important to be your child's advocate so that they can get the proper help and be proactive in looking into preventative measures for them.
We have only a couple of minutes left. I know you're doing a phenomenal work in an area which people don't even know how to get help. And there are some events you're organizing to, it's a voluntary organization, so you need to raise funds. So why don't you share with us some of the things you're trying to do?
Sure. One of the upcoming things, if you'd like to support the work that SAMHAJ and NAMI do, is there is a event coming up on March 7th. It's actually a concert organized by Hidden Gems, which is a local nonprofit that that sings, essentially. There's a group of singers. And so March 7th, it's coming up at in South Brunswick, and tickets are available at hiddengems.org. You can go online and you can purchase tickets right there. We also have a whole range of educational events coming up, including a talk about addiction, a special session on how yoga can help with wellness, and then of course we have actually an art show coming up in Cranberry called Mind My Art.